Indiana University of Pennsylvania recently received a financial boost in its effort to help the community fight drug and alcohol addiction. Every summer for the past 25 years, IUP's Marty Institute has encouraged locals to speak out about addiction, their addiction. And recently, the Pennsylvania Commission on Crime and Delinquency awarded a grant to IUP to help save those who have been overdosing. It also will assist their programs for recovery. Joining us this morning, two guests. Dr. Eric Lauber is the Director of Community and Behavioral Health at IUP's Marty Center. He is also Professor of Journalism and Public Relations at IUP and is conducting an important research project that studies the community perception of addiction. Cami Anderson is the Executive Director of the Armstrong, Indiana Clarion Drug and Alcohol Commission. Both of you, thank you for being here and talking about this important subject.
Thank you for allowing us to come on today.
We appreciate it. Eric, first of all, talk about where does it begin? Does it begin with alcohol addiction and then moving to something else? Does it begin with pain pills and then move on to harder drugs? Have we figured out at this point where it starts to nip it in the bud?
You know, I think it starts from multiple pathways. I don't think there's just one way that people end up with heroin addiction or opioid addiction. Certainly prescription pills have been an introduction for some. It's not clear whether they already had some other substance use issues before they tried prescription pills and ended up with a problem with like heroin. But there's always been some who have progressed from marijuana, from alcohol to other drugs and then find themselves at heroin addiction somewhere down the road.
How much is it happening in the counties we're talking about?
More
Indiana, Armstrong, Clarion.
Yeah, more than I think most people realize. Actually, Cami would answer that better, I think. How bad is it?
It's bad. It probably affects about 1 in 4 families throughout our counties, and sometimes higher than that. But almost everyone now has had a relative or a friend have to deal with the problem in some way.
Is heroin the most prevalent thing that you're seeing?
It is the #1 drug of choice right now in Armstrong and Indiana for people seeking treatment.
For people seeking treatment, does that change? I mean, more so than alcohol?
No, that's what for people
because they're not
just
necessarily seeking treatment. Is that what it comes down to?
Exactly.
Okay.
So the biggest drug of choice that's being used in our areas is alcohol.
Mm-hmm.
Secondly, I would say it's marijuana, and third, I would say opiates or heroin.
Got it.
But for people seeking treatment, opiates is what brings them to us most of the time to get into treatment.
Interesting. We're dealing with two different college communities too. IUP obviously in Indiana, Clarion in Clarion as well. With the student population, does that change things in terms, it changes the population every year that you've got different people coming through, but does that change then the course of treatment, the action, the stigma, the perception of what's going on with
I think there's a perception that somehow college students are at the forefront of this crisis, but that's not been the case. Mm-hmm. You know, the folks that have been passing away from overdose have been community members. You know, we're not seeing a lot of college students passing away from heroin. Certainly there's a lot of marijuana and there's a lot of alcohol abuse in college populations, but even non-college people that are that age group are experimenting and trying drugs, and we're having trouble with some of them becoming addicted sooner or later. I just recently did a survey. We were trying to find out about stigma about these issues. And there's just a lot of misinformation about addiction in general from a lot of the general public. These counties have a lot of rural communities. They've been taught to think about addiction a certain way. For some of them, they see it as a lack of willpower or a problem with their character. That's not how I see it. I don't think that's how many in the medical field see it. Addiction is a gradual rewiring of the brain that occurs with repeated exposure to these mood and mind-altering substances. You don't know you're going to get it. No one tries to get it. It slowly accumulates, and finally you have some condition that we would now call addiction. Most people want to get out of that. You know, it's not a lack of willpower or character, not my opinion. But that's what we're seeing sometimes in the survey results. So we need to do a better job educating the public, and that's what we're doing.
I guess that leads directly to what it is that you're doing. How do we go about doing that?
Well, what we have done in our county, it was about late 14, 15, that our coroners called me and said, we have a problem here. We're seeing a huge spike in overdose fatalities from heroin. And so as that became the thing around the Southwest counties happening so much, what we did is we decided we were going to address this in phases, and the first phase was to get Narcan kits out as much as we could to first responders, family members, clients themselves, all throughout our counties. And so far we've given out over 4,000 kits. And we've had about 400 overdose reversals that we have had documented.
Right.
So it is working. And then the second phase we wanted to do is educate people, educate the medical society, and get our staff into the hospital so that when somebody's brought in for an overdose or a related problem to substance use disorders, they would get referred to our folks and they would be seen and sent to treatment. And if I could just read some stats from our program at the
We're running
hospital.
we're running a little short on time, but please
Okay.
do. Yeah.
750 patients have gone through our program. 64% of the patients were screened by our staff. Of those 64%, an average of 73% of the people that we see go directly from the hospital to treatment. And that is huge because the national average is 10 to 11%.
So it's an enormous difference in terms of the number of people, if you get them while they're in the hospital to then say, let's get you some help
Yes.
before they go back on the streets.
Yes, and we have that small window of opportunity
Right.
to get to work with those people and get them to agree to us. So we
Seems
use
to be making a big difference.
We use a case manager and we use a certified recovery specialist in the hospital that has been in their situation, and they like to talk to both people and,
they're
the
able
family
to get
members.
that. All right. Thank you very, very much, both of you, for the work that you're doing and the difference that you're making in our communities. We appreciate you being here. We'll be back with more of the Sunday Business Page in just a couple of minutes. Keep it here, please.